Necroguard, a lighted surgical retractor with novel force detection. Necroguard was designed to combat improper surgical retractor usage during mastectomy surgeries, which can lead to skin flap necrosis. A mastectomy is an open surgery where cancerous tissue is removed from one or both of a patient's breasts. There are several different types of mastectomy surgeries, and there are over 100,000 mastectomies performed annually in the United States. During the mastectomy, surgical retractors are used to expose the surgical site and allow surgeons to remove the breast tissue. As shown on the right, surgical retractors pull back on the patient's skin flap throughout the surgery, which can last up to 3 hours. However, using the retractor to pull on the skin flap for extended periods of time can cut off the blood supply to the tissue, causing necrosis. Necrosis, or tissue death, is typically caused by applying excessive force to the tissue for long periods of time. This can lead to patient pain after the procedure, infection, and additional reconstructive surgeries. Necroguard was developed to help prevent skin flap necrosis by incorporating force detection into a surgical retractor. Necroguard was created using design controls that were developed by interviewing breast surgeons and observing mastectomy surgeries. Throughout this need-finding process, it became clear that there were 3 key design controls that Necroguard must validate to be successful. First, the retractor must be able to detect when excessive force is being applied to the skin flap and alert the user. This way the user can adjust the retractor and not inhibit blood flow in the tissue. Second, the retractor must be able to light the surgical site as well or better than current lighted retractors, which are the type of retractor used during mastectomy surgeries. Third, the retractor must have an ergonomic handle that allows surgeons and their assistants to comfortably hold the device in all orientations. This is because surgeons and their assistants constantly pass the lighted retractor back and forth throughout the surgery. With these design controls, a proof-of-concept prototype was designed. To detect excessive force, 2 force sensors were installed into the tip of the Necroguard retractor. When the force sensors register that too much force is being applied, an LED in the retractor's handle turns from green to red to alert the user. This way the user can adjust the Necroguard retractor to not inhibit blood flow in the tissue and ultimately prevent skin flap necrosis. To light the surgical field, the Necroguard surgical retractor is equipped with 3 LEDs. The user can adjust these LEDs by turning a dial at the rear of the handle to achieve ideal lighting conditions throughout the surgery. Finally, an ergonomic handle was designed to allow users to comfortably hold the retractor in all traditional orientations. The prototype was then 3D printed and assembled before a proof-of-concept test to determine if the prototype validated the design controls. The proof-of-concept test involved using a chicken breast as a tissue model. After making an incision into the chicken breast, the Necroguard retractor was pulled in various directions to test the force detection system and also the comfort of the handle design. When excessive force was applied, the LED alert system began blinking red and then blinked faster the longer the excessive force was still being experienced by the force sensors, as shown here. Additionally, the lighting system was tested by adjusting the LED brightness while retracting the chicken breast upward and exposing the surgical site. These tests validated Necroguard's potential for reducing skin flap necrosis during mastectomy surgeries. However, further testing and research must be done to determine if force sensing can truly predict skin flap necrosis during mastectomy surgeries.